immigration status is checked at their GP surgeries or at their hospital wards, that their data is being shared with the Home Office. People have lost faith in the NHS. Now they see hospital and fear deportation. They fear mountains of debt that they will never be able to pay back. Our own clients have faced this themselves. One told us about how she screamed when she opened her letter about charging, feeling weak at her knees at the charge of over £15,000. She was regarded as homeless at that time. Healthcare, that their immigration...
I'm Tony O'Sullivan. I work with the Safe Lewisham Hospital campaign, and also I'm co-chair nationally of Keep Our NHS Public, which Safe Lewisham is affiliated to. This is about very at-risk, vulnerable migrants who are here for numerous different reasons. There, but for the grace of God go we, from all over the world, and people who have been born here or been here since childhood and are deemed not to have residency rights by this wicked government. So the migrant charges in the hostile environment affect probably over 1 million people in this country. In this country of about 68 million. So that's over 1% of our population are deemed not entitled to free NHS care at the point when they need it. And a fifth of those are children. So there's over 200,000 children who are not entitled to free NHS care when they need it.
Save Lewisham Hospital campaign, and very much for what we're doing here this morning. And I'm listening to Tony giving us great insight and information to the reality of how people and refugees are suffering. And I'm grateful very much for the Save Not Passports and for Lewisham Migrants Network as well, for coming together and joining together to fight and to speak up and to raise awareness about this issue. I remember when I first became a Member of Parliament, and I was out here with you during a campaign, again, looking to save the hospital services, and it was very much to do with workers' rights. And since being an MP, I joined a campaign, and it was to do with people that are working for the NHS, and people that died during the coronavirus, and nurses and doctors that didn't have the right to remain in the UK at that time. But if they died while they were in service, then hospitals and nurses, their families could then have indefinite leave to remain, and that was right and that was fair. But when it came to porters, cleaners, if they died, their families then didn't go on to have the right to have indefinite leave to remain in the country. And I worked with GMB. It was a very small campaign, because the first moment they spoke about it, the first moment it hit media attention, then the government did a U-turn and they gave those families the right to have indefinite leave to remain should their relatives also die as a result of the NHS. Any death is cruel, any death that could be saved is a tragedy, and anybody that dies from the coronavirus has, I'm sure, all of our deepest sympathy, them and their families. But what I'm trying to highlight here is the gross inequalities that exist, and the gross inequalities that causes so much tragedy, pain and disheartenment to so many people's and families' lives. And what I'm so grateful for is the raising of awareness here.
I'm councillor from Crofton Park ward and speaker of Lewisham Council, and I see a lot of people from my ward here, so my ward is very passionate about NHS and migrants. Yesterday we had a very good rally in Lewisham, you may have seen. We received a little ML, and thousands of people turned up on the streets of Lewisham and in Deptford to receive us. So it wasn't just a receiving of that puppet, it was a protest against the policy of Priti Patel, that we are not accepting this hostile environment in Lewisham. It was appreciation of the work everyone has been doing with migrants in Lewisham. The Lewisham Council, as a borough of sanctuary, we received 100 refugees families here, and now we received the first Afghan refugee family here. It was appreciation of everyone, like this Lewisham Refugee Migrant Network, and all those organizations who have been doing that. That's why ML, when it came, they first decided to come to Lewisham. We were the first council to receive her. So this was an accreditation, appreciation, and recognition of the work which we have been doing in Lewisham as a borough of sanctuary, and the people of Lewisham who do care about them. And now coming to this migrant charges, I was 2 years ago in Healthier Community Select Committee, and when this report appeared to us, and they are using Experian to check people, their migration record, and if they live in Britain or not. And we were really astonished at that committee. It's still in the minutes of the committee, you can read my comments there. And I said, that is totally wrong.
In the later stages of her pregnancy, the patient was destitute and she was street homeless, and she still had the burden of this debt. Another patient had her second child at the trust in 2018. She had fled her country due to domestic abuse. During the day of the delivery, she was approached on the ward by a trust staff member who told her she would have to pay £6,000. On hearing the amount, as Rosario spoke about earlier, her blood pressure rose and she had to stay in hospital for an extra 3 days.